I don't know if you have noticed, I noticed outside that says Public Health Human Rights in the logo of this school. And what we have been listening now is equity, healthcare and public health, response to clear needs, homelessness. Wow, this is a really incredible agenda that has been posed by the commissioners, and thank you very much for the framework. What I want to address now is to bring you out of your cities, out of your country, and to take you to the other dimension, to the global and regional dimensions. The world is watching you, and really, so don't be scared. The world is watching you, is watching what you do. That's the problem of leadership. When you have leadership, people will be watching you. But I just want to make you aware that you have also watched and you have learned a lot from the world. For example, the closed streets on Sundays and weekends. That was first started in Bogota. The bus rapid transit systems, the BRTs, they were started in Curitiba, in Brazil. So you have learned as well from the world. So I want you to just to change you to a different setting. So I will try to provide a quick review of the global and regional processes and open a discussion on how you can influence and use such processes for your benefit. I don't want you to read all this timetable, but this basically since 1972, the World Human Environment Dimension started all the things that have been happening, but if we focus on this part, in 2007, the WHO Commission on Social Determinants of Health developed a knowledge network on urban health, and this network provided a framework to try to understand what is happening inside our cities. And I will not go through the details, but basically what you have is to acknowledge that beyond your place, your local city or municipality, there is a global and national context. You were talking about direct funding from the federal government to the cities. Well, there is a national context, but there is also a global context. And we have to act between the municipal determinants and the conditions of people. And that is where we act if we want to influence the final health outcomes. One of the key issues that this network raised is the issue of slums. You were talking about homelessness. Well, in many areas of the world, and here also in the States, poor housing is one of the biggest problems. Here, one of the issues that were raised is the problem of slums, and this was considered in the 2010 WHO World Health Organization and United Nations Habitat Report, the Hidden Cities Report. What this report said is that the majority population is now urban, and that we have had an incredibly fast increase in in urbanization, and this has become a major global issue. Here in the States, your rate of growth in cities has been more paced, more slower than what you have seen in the developing world. And this has become one of the most important global health issues. This has outpaced government ability to tackle with that. There is a disproportionate amount of poor health, as you have shown, because of the poor living conditions. And we require local involvement of communities and of governments. So it is true, we need the empowerment of people, as Mike just mentioned. Well, this was taken in 2010 to this initiative of World Health Day by WHO on how we mentioned 1,000 cities 1,000 lives. And basically trying to call to 1,000 cities throughout the world to say, hey, what are you doing and how can you tackle health? Well, this call was at the end manifested by a meeting in Kobe, Japan. Not all the 1,000 mayors attended, but a lot of them attended. Not only 1,000 cities registered what they have been doing, but 1,500 of them. The 500 came from China. So they were able to provide a lot of that. But I just want to highlight what those attending that meeting in Kobe committed to in this call to action. They said, we commit to promote health and health equity in cities. So the issue of equity, what you are raising, was committed clearly in that meeting. We commit to collect and analyze data in a disaggregated manner. Before that, this was hidden. That's why the report is called Hidden Cities, because we don't see these inequalities. They commit to intersectoral action. We commit to assess the impact on health of urban policies and programs, other policies, how they affect health. Use urban planning, really insert public health into the urban planning processes, and provide the space for citizen participation, something that might sound common for you, but in most not so democratic countries does not happen that easily. Here you have, in the case of the Americas, for you to see the issue of inequity in some cities in the Americas has improved, but in others it has not improved. We have very large cities in the Americas that have been growing over the last few years. So that is why the countries of the Americas met together and asked the Pan-American Health Organization, that is the regional office of the World Health Organization for the Americas, and the Americas include from Canada to Patagonia and the Caribbean. They asked the PAHO to develop and to bring a consensus on a regional action plan. So believe it or not, the United States promoted this, and the United States was a heavy supporter of this initiative. And I remember clearly Niels Delaire from the Department of Health and Human Services talking in the opening meeting of the Directing Council, calling for all the ministers, listen guys, we have to pay attention to urban health. So it was approved in September of 2011, the Regional Action Plan. And the Regional Action Plan is focused on strengthening institutional capacity on stewardship and provide the ministries of health and their departments of health at the local level on focusing on urban health planning, centered in people and in communities. And the plan has 5 lines of action, one on policies and plans on urban health planning, the health services reorientation, exactly what Philadelphia is doing, regulatory frameworks and governance, use the power of regulations, use the power of the health authority, as New York just mentioned, national and regional healthy urban municipal networks, use the networks of municipalities, of city mayors, of city commissioners to bring this together and strengthen the knowledge, information, and data exchange, the research, and the health impact assessment tools. The Regional Action Plan provides and asks countries to use different tools. There is an urban heart tool that you might know. It's basically what you are doing in your maps, but trying to go behind it, trying to go into the causality chain and trying to look to the health determinants and put them together, your maps with the health determinants. The health impact assessment of policies, plans, and programs, the urban health observatories. Here we have we have from Brazil a very good example of your urban health observatory, a way to systematically collect data and put it clearly on the table for decision makers. The development of guides. Here you have one of my pet guides, the active design guides that were developed intersectorally, interdisciplinary, with public health working with street designers, with architects. Really fantastic, fantastic tool that we want to bring it, make it available for everybody. The networks of municipalities. Here is the Mexican network, one of the strongest in the region, but there are many other ones. And use the partnerships. And we launched in New York, by the way, and Joe Buford was part of this, the first Wellness Week. The first Wellness Week that is going to start in this weekend, now related to parks and health. What's the Association of Health and Parks? And this is happening, the Wellness Week, now throughout the whole Americas. This was taken in 2011 also to the UN high-level meeting on non-communicable diseases, where urbanization was clearly identified as a cause and as a factor for NCDs. And the political resolution of 2011 called for work on the urban setting. Joan was talking about the Sustainable Development Goals. Yes, in the past, in the year 2000, we as a planet, we decided to support developing countries' poverty reduction initiatives, as if poverty was only there in developing countries. And you have shown that happens all over the world. Okay, SDGs now is focused on every country of the world. So it's an all-country focused on economic, social, and environmental pillars of development. And it has 17 goals. Why are we working on this? Well, the 8 Millennium Development Goals proved to be a quite successful experience. Most of the countries advanced, and most of the goals, the ones in green, were achieved. Some were more or less achieved, and some were not achieved. So I would say this is a successful story for the world, and mainly if we think that these were developing countries. Now, in a few weeks, New York City will be crowded with all the people attending the summit on sustainable development. They are going to discuss 17 goals, where we have a third goal on healthy lives for all ages, and an 11th goal to make cities and human settlements inclusive, safe, resilient, and sustainable. Okay, 17 goals in total. Every country, every citizen can reflect themselves in these goals. And all these goals are interrelated. And that's the beauty of this assessment. Here you have cities, here you have health and cities, okay? But they are interrelated to each one. How are we going to work on this will be part of the trick. But health is interrelated to other goals, and including cities, and the International Society on Urban Health has taken this in the Dhaka Statement on Urban Development. What's next? Well, after New York, we have Paris. Paris is going to focus on cities. On what? On the climate change agreements. Hopefully there will be finally a climate change agreement, a global climate change agreement, and cities will play an incredibly important role. Fortunately, last week, the meeting in Bonn was not very successful, so I am a little bit concerned, but we have to work, and please, this network of cities for climate change has to work on that. Next year in Ecuador, in Quito, Ecuador, we will have the UN Habitat 3 meeting. I would say that's an opportunity to bring to the table the health agenda. The perspective is, yes, to have a city that is safe, but also to have a city that is healthy. So the invitation for all of you is to influence on and use all these processes. Cities have the potential to implement the local, national, regional, and global commitments. And here you have a set of global commitments that have been signed and approved by your country representatives in the global fora. You can work on this and use all the inventory of commitments for that. There is a role for you in the global agenda. The UN agencies and the UN countries usually meet here, but there are other organizations, and you play a role as non-state actors necessarily. And finally, you can influence on data, knowledge, social support of policies, implementation, and accountability. Thank you very much. And I stop just in time.